Your cat suddenly starts following you from room to room. They wait outside the bathroom door. They curl up against your chest when they normally prefer the foot of the bed. They seem unusually focused on you, almost as if they're monitoring your every move. Most people assume this is affection. Sometimes it is. But when a cat refuses to leave your side for days or weeks, something else may be happening. Cats experience the world through scent, sound, body language, and tiny physical changes most humans never notice. That means your cat may be reacting to changes in your body long before you connect the dots yourself. Some of those changes are harmless. Others can be warning signs linked to serious health conditions. And one condition on this list has left doctors, pet owners, and researchers asking how cats seem to know something is wrong before anyone else does. Cats are often described as independent, but science tells a more complicated story. In a study published by researchers at Oregon State University, cats demonstrated attachment behaviors toward their owners that resembled secure bonding patterns seen in other companion animals. In simple terms, your cat pays much closer attention to you than many people realize. Veterinarians have also documented countless cases where cats changed their behavior before owners discovered underlying medical issues. Cats may not understand diseases the way doctors do, but they are experts at noticing changes in scent, breathing, movement, routine, and emotional state. Today, you'll discover 7 diseases and conditions that can sometimes cause a cat to become unusually attached, clingy, or protective. Pay close attention all the way through because number 7 is the most surprising and emotional example on this list, and it may completely change the way you view your cat's behavior. Number 1. Stress and anxiety disorders. Your cat often detects stress before you consciously recognize it yourself. When you're anxious, your body releases hormones like cortisol and adrenaline. These can influence your scent, breathing pattern, posture, and daily routine. Animal behavior experts have long observed that cats respond to changes in human emotional states. Research published in Animal Cognition found that cats can distinguish certain emotional signals from their owners. If your cat suddenly becomes more attached during busy work periods, family problems, or emotionally difficult times, they may be responding to those subtle changes. Watch for headaches, trouble sleeping, constant worrying, muscle tension, or feeling overwhelmed. One clear action you can take is to monitor your stress levels for a week and compare them with your cat's clingy behavior. Sometimes the pattern becomes obvious very quickly. Number 2. Migraine disorders. Many people report that their cat becomes unusually attentive shortly before a migraine begins. Cats may detect changes in facial expressions, body temperature, movement patterns, or even scent changes that occur before migraine symptoms become severe. Some neurologists believe animals can notice subtle behavioral shifts during the migraine prodrome phase, the period before the actual headache starts. If your cat repeatedly seeks you out, stares at you, or refuses to leave your side before headaches develop, pay attention. Watch for visual disturbances, unusual fatigue, sensitivity to light, mood changes, or neck stiffness. A helpful action is to keep a migraine journal and record your cat's behavior. Over time, you may discover that your cat is providing an early warning signal. Number 3. Respiratory infections. Cats are incredibly sensitive to breathing sounds. A mild respiratory infection may alter the rhythm of your breathing, create subtle congestion, or change the sounds you make while sleeping. Veterinarians frequently note that cats react strongly to unusual sounds within their environment, especially those connected to their owners. If your cat suddenly stays close while you're feeling run down, they may be responding to changes in your breathing patterns rather than the illness itself. Watch for persistent coughing, congestion, sore throat, fatigue, fever, or shortness of breath. One practical action is simple. If symptoms linger longer than expected, schedule a medical evaluation rather than assuming it's just a common cold. Number 4. Diabetes. A cat's sense of smell is remarkably powerful. Uncontrolled diabetes can sometimes create noticeable changes in body odor and breath due to chemicals called ketones. These compounds may produce a slightly sweet or fruity scent. Medical literature contains numerous reports of animals reacting to metabolic changes in humans. While dogs are more commonly trained for detection, many cat owners have reported unusual feline attention during blood sugar fluctuations. Watch for excessive thirst, frequent urination, unusual fatigue, blurry vision, or unexplained weight changes. And before we continue, remember this: the next conditions become significantly more serious. and some owners only recognize the warning signs after looking back months later. One action you can take is to discuss blood sugar testing with your doctor if these symptoms sound familiar. Number 5. Heart failure or serious heart rhythm problems. Cats are highly sensitive to movement, vibration, and breathing changes. When the heart struggles to pump efficiently, breathing patterns often change. You may breathe harder during activity, feel exhausted climbing stairs, or experience subtle swelling and fatigue. Organizations such as the Mayo Clinic identify shortness of breath, fatigue, swelling, and reduced exercise tolerance as common warning signs of heart problems. Your cat may begin resting against your chest more often because your body's normal rhythms no longer feel the same. Watch for breathlessness, chest discomfort, swelling in the legs, dizziness, or unusual exhaustion. The most important action here is immediate medical evaluation if symptoms appear or worsen. Heart-related conditions should never be ignored. Number 6. Cancer. This is one of the most debated and fascinating areas of animal behavior. Certain cancers can alter body chemistry and produce volatile organic compounds. These are tiny scent molecules released through breath, sweat, and skin. Scientists have studied animals' ability to detect these changes for years. While most research focuses on dogs, many veterinarians acknowledge reports from cat owners whose pets behave differently before cancer diagnoses. If your cat suddenly becomes obsessed with one area of your body, repeatedly paws at a location, or insists on lying against the same spot, pay attention. Watch for unexplained weight loss, persistent fatigue, unusual lumps, night sweats, or ongoing pain. One clear action is to schedule a medical examination if symptoms persist without explanation. Number 7. Stroke or medical emergency warning signs. In 2018, a woman in Minnesota described an experience that she still talks about today. Her normally independent cat spent an entire evening refusing to leave her side. The cat followed her from room to room, jumped onto her lap repeatedly, and became unusually vocal. Nothing seemed wrong at first. Hours later, she developed sudden weakness and difficulty speaking. Her family recognized the symptoms and rushed her to the hospital. Doctors confirmed she was experiencing a serious medical emergency that required immediate treatment. No one can prove the cat understood what was happening, but the timing left a lasting impression on everyone involved. Stories like this appear again and again around the world. Cats seem to notice tiny changes in movement, coordination, scent, breathing, and behavior that humans overlook. If your cat suddenly becomes intensely focused on you while you also experience facial drooping, confusion, numbness, weakness, trouble speaking, or balance problems, treat it as an emergency and seek medical help immediately. Your cat may stay close because of stress and anxiety. Your cat may react to migraines. Your cat may notice respiratory infections. Your cat may detect changes linked to diabetes. Your cat may respond to heart problems. Your cat may become alert to body chemistry changes associated with cancer. And in rare cases, your cat may react when a serious medical emergency is developing. Of course, none of these behaviors can diagnose a disease. Cats are not doctors. Sometimes they simply want comfort, warmth, attention, or companionship. But unusual changes in your cat's behavior should never be dismissed completely, especially when those changes appear alongside symptoms in your own body. Tell us in the comments, has your cat ever become unusually clingy right before you realized something was wrong with your health? If someone you care about loves cats, sharing this video could give them a new reason to pay attention to the small signals their pet may be sending. And next time, you'll discover the surprising behaviors cats show when they choose one person in the home as their favorite, and what those signals really mean. Sometimes the first warning sign is already sitting beside you.